Hey everyone, it's Argonath here from The Right Way, and we have some information from an independent expert group that just goes to show how badly this stupid government has been running New Zealand with the COVID situation, and how useless they actually are. So we're going to have a read of what was said. This is from the Radio New Zealand, no, News Talk ZB website. They have an article on here. Before we start, if you like the video, give it a thumbs up. If you don't like the video, you're welcome to give it a thumbs down. And hopefully if you like my content, then please subscribe as well. So let's have a look and see just how badly this government has actually done in New Zealand's COVID response since the Delta outbreak began, and even before that as well. An independent expert group told the government, so this is appointed by the government, told the government in September that the borders cannot start to reopen until vaccination coverage was well over 90% and the shortfall for Māori was addressed. So Māori, for anyone that's not in New Zealand, Māori are the indigenous population and their vaccine levels are lower than the rest of the people in New Zealand. A September 23rd letter from Sir Brian Roche, head of the government's independent continuous improvement group, also said bolstering testing and contact tracing was an urgent priority, and the Delta outbreak had shown a very poor level of preparedness of hospitals. You would have thought that when we had a year of no COVID, the government would have spent that time and money doing up our hospitals and getting them ready for future outbreaks if required, but no, all they did was sat on their bloody hands, wasted money in lots of other places that we didn't need to, and now we are all going to pay the price for this. The letter and accompanying report is revealed in a tranche of official documents that the government has dumped today. So basically the government released a whole bunch of official documents for people to look at and did it at a time which is most convenient so that wouldn't hit the news media. Timing is critical. We need to move with urgency to ensure we do not expose the country and New Zealanders to unnecessary risk and harm, the report said. We are mindful that even the most conservative scenario post-reopening will inevitably involve the virus in one form or another, making its way into the community for periods of time or permanently. Such a scenario may have previously been seen as alarmist, but is inevitable in our view based on what we observe from the most recent outbreak together with international experience. So that's pretty much what most people in New Zealand have been thinking, that this is going to be inevitably become endemic across New Zealand. But no, the government with their blinkered attitude just still went for a zero COVID policy until it was no longer tenable for them to do so. The report also noted how the vulnerable in Auckland were not adequately protected in the current outbreak. Assurance is also needed that a phased reopening identifies, supports and protects the vulnerable. Of course, when we did get into a vaccination mode and start to really get stuck into vaccination, the government didn't prioritise Auckland, and in particular South Auckland, which are a lot of Indigenous and Pacific Island communities where most harm would occur in an outbreak. That should have been done first before worrying about the other parts of the country. They should have prioritised that particular area, but they didn't do that. There have been examples of that not being the case for some sections of the community during the current outbreak. Addressing this will be critical to minimise issues of inequity within the community. I don't believe too much in terms of inequity. It would have been good to prioritise Auckland and give them first chance, first dibs in getting vaccines, but pretty much whoever wanted to be vaccinated can be vaccinated, except for far-reaching rural communities where it's hard to get the vaccines into those particular communities. That's where the inequities would occur. I would say it's more rural and urban rather than to do with the race of a person. Rose's letter addressed to COVID-19 response Minister Chris Hipson said that the outbreak had exposed urgent issues with respect to New Zealand's preparedness for reconnecting because the government just sat on their ass doing nothing. They are absolutely hopeless. Delta has fundamentally changed the model of preparedness and response. We must adapt accordingly. We do not have a do-nothing option. Roche said the reopening of borders were a four-pronged approach: vaccination, border processes, public health measures, and the health system safety net. Vaccination coverage will need to be well over 90%, and it's clear that our New Zealand vaccination program is failing certain populations. most notably Māori, who are at higher risk of serious disease and death than non-Māori. Addressing such disparities is an urgent priority. He called for all efforts to take the vaccine to communities and for more funding. A month later, the government announced 120 million to boost Maori vaccination rates. A month later. Very fast-acting government, isn't this? Roach said that more movement across the border was essential to address escalating economic and social harms, including alternatives to MIQ and more saliva testing and rapid antigen testing. I've done videos on this before. The government went for an unaccredited rapid testing provider because it was part owned by the New Zealand Super Fund, which is a government thing from using our money, our KiwiSaver money, and so they gave it to that, and it just stinks to high heaven, whereas they could have gone to Reiko Science, who had an accredited antigen test, and we could have had that in the community much faster. But no, the government are just hopeless at anything, right? Including alternatives to MIQ. The MIQ system is just absolutely disastrous. By now, we should be letting people in who are double jabbed and have tested negative before boarding the flight. They should be allowed to self-isolate. Currently, we've only got very small numbers of people in isolation from overseas who actually have the virus. There are lots more in the community that have the virus compared to the people coming in. It makes no sense to carry on with the MIQ system. We should be allowing people in for Christmas if they've tested negative before coming on the plane and they're double vaccinated. Oh my God. Roche has previously implored the government for more widespread use of different testing methods, including a report from September 2020. He also previously told his health ministry to bolster contact tracing capacity, and did so again in a September letter. And then we found out just a few weeks back that the contact tracing capacity is basically breaking. Even with just a couple of hundred cases a day, they can't handle that. Before the Associate Health Minister Aisha Verrall about 2 or 3 years ago said that we need a gold standard tracing system which could handle 1,000 cases a day, and it's falling over with just 200 cases a day. Again, complete ineptitude from this government. This has been the subject of recurring recommendations from our reports and needs to be addressed as a priority. The government is useless. They can't actually organise anything. They can't organise themselves out of a paper bag. In addition, ongoing issues with innovation around testing and electronic contact tracing enhancement need to be resolved. Rapid antigen testing is a critical prerequisite. We cannot afford the delays in its introduction that have been experienced with saliva testing. The report added that the backlog of testing delays at the start of the outbreak, when people waited for up to 12 hours in line, ended up compromising early outbreak containment. Who's going to go and bother wait for 12 hours in line to be tested, right? You need to have that sorted out. A lack of prioritization means that priority workers in key locations of concern were not processed with urgency. Again, just more criticism on this government about the inept way that they've handled the COVID response since the Delta outbreak. The ability to detect and respond immediately will be a key element of success. It is our view that rapid antigen testing is introduced for areas that have vulnerable groups before entry into hospitals, aged residential care facilities, prisons, forensic facilities, and so forth. Oh, I need a bit of water. Only yesterday did the government reveal that rapid antigen testing will soon be available in pharmacies and more businesses. Soon will be available. How often is soon? 1 week? 2 weeks? 4 weeks? Finally, he said this is the biggest thing. The outbreak has exposed how poorly hospitals were prepared for Delta. The system's ability to deal with Delta and other business as usual functions of the health system has been found wanting because they didn't do anything during the year when we didn't have any COVID. DHB Chief Executive and Chairs have recently written to the Minister of Health that they are not confident in the level of preparedness planning. The current outbreak has revealed the very poor level of preparedness of hospitals for Delta. Auckland, which has a large COVID-19 prepared health system relative to the rest of New Zealand, has essentially been stretched to capacity, which is bad because that means the rest of the country would not be able to cope with this. Significant amounts of planned care have been placed on hold. So this is all the other surgeries like cancer care, elective surgeries and so on. They're all on hold because our system can't handle it, because this government is useless at getting anything done. We're seeing from overseas evidence that even at 80% vaccination rates, hospitals and health systems are under significant pressure. There's also a lot of evidence that the missing 20% are likely to be high risk of poor outcomes. Roche said the outbreak has also exposed a shortfall in proper engagement of Maori and Pacific Island providers in the outbreak and overall response. So I'm kind of in favour of that. If being treated by people of your own ethnicity will lead to better vaccinations, then that should have been done. But again, the government has dragged the chain on this particular thing. Roche repeated is concerned about the response being reactive rather than prepared and anticipatory of the work. That's what the government did. They just sat on their hands thinking, yay, we've got no COVID in New Zealand and we'll just stop it at the border. If we don't need to do anything, we don't need to worry about any further outbreaks. They just didn't do any planning at all. They're absolutely hopeless at this. The current operating model is failing. We will fail in an even more complex operating environment after reopening. A fully integrated pandemic preparedness and response unit, which he previously called for, was needed. Hipkins welcomed Rose's report. Hipkins is the COVID response minister, saying it had helped inform the government's improvements and the responses since September. Progress has been achieved and all key progress has been achieved. What does that actually mean? Nothing. We've made some progress. It could be as little as appointing someone to a job but not actually doing anything. It's ridiculous from this particular government. Anyway, this is a really interesting report here that just goes to show how inept the government has been with the Delta COVID response, and God help us once we start opening up again, and just how inept they're going to be in the future running of this particular country. Let me know what you think in the comment section. Again, if you like the video, give it a thumbs up. If you don't like the video, you're welcome to give it a thumbs down, and hopefully you'll also subscribe to my content. Anyway, hopefully I'll catch you in the next video.